This is the UNC-12 periodontal probe. The probe is made up of the handle, the shank, the terminal shank, and the working end. Each black line represents 1 millimeter, going up to 12 millimeters. The two thick black lines represent 5 and 10 millimeters. The probe is used to measure periodontal pockets when assessing a patient's periodontal status. These pockets cannot be seen on radiographs, so this is a very important step during patient assessment. We probe adults and adolescents when indicated by PSR. Contraindications of probing include probing primary teeth, medically compromised patients, newly erupted permanent teeth, or a tooth in distress such as a dental abscess. Each tooth is split into 6 parts: distal line angle to interproximal, distal line angle to mesial line angle, interproximal, both on buccal and lingual, making 6 parts per tooth. The deepest probing depth between each part is recorded with 6 measurements per tooth. The probe is held with light grasp and light pressure when probing as not to cause injury. On a live patient, you see tissue blanching when you are at the junctional epithelium. Probing order when probing the fold mouth is 1 to 16 buccal, 16 to 1 lingual, 32 to 17 buccal, and then 17 to 32 lingual. I am now going to demonstrate how to use the periodontal probe. I'm going to be probing teeth 5 and 6, and I'm going to start on number 5. When you are beginning, you want to insert the probe into the sulcus and have it pointed towards the apex of the tooth. You want it tilted away from the tooth so that it is in the sulcus. You do a walking motion from the distal line angle into proximal, and when you get into proximal, you tilt 10 to 15 degrees to get into the coal space. This reading is 3 millimeters for this section of the tooth. I will then go from the distal line angle, walking, to the mesial line angle, and that is a 4 millimeter pocket. I will then go from the mesial line angle into proximal and tilt to get into the coal space, which is also a 4 millimeter pocket. On to number 6, distal line angle, pointed towards the apex of the tooth, and tilted from the tooth. Walking, that's 4 millimeters. 5 millimeters. 5 millimeters. Now I'm going to teeth 11 and 12. When you cross the midline, the order changes. Instead of going distal line angle first, you start the mesial line angle to interproximal, mesial line angle to distal line angle, and distal line angle interproximal. So we're on number 11 here. 4. 4. 6. 1. On to number 12, same thing. 5. 4. 6. Then I will do the rest of these teeth, coming around on the lingual to number 12. We go back to the other order. 4. 3. 5. On to number 11. 3. 4. 5. Coming back around on the lingual. Goes back to the other order. We're number 12 here. 4. 5. I think I missed one. Okay, coming back around on number 6. Things change a little bit here since we crossed the midline, so I'm going to start at the mesial line angle. Go into proximal, walk it, 3, mesial line angle, distal line angle, 3, distal line angle, angle into the coal space, 3. Then on to number 5, same thing, 5, 4, 6. Now onto the mandible. 4, 3, 4, 4, 3, 4. Coming around, I did all the anteriors. I am now on number 22, and I'll do 21. It's 22. 3, 4, 3, 4. Coming around on the lingual. 4, 3, 4, 3, 2, 3. Now I would have done all the anteriors, and then I'm coming back on the lingual on the lower right. So we're on number 27 here. 3, 4, 4. You want to pause it? Okay, on to number 28. 4, 3, 6. And then I would go on to the rest of the teeth, and that's how you use the periodontal probe